The FDA does a CYA, claiming that the war against the then trending ivermectin drug use was merely a recommendation against and nothing more. This as a civil lawsuit against the agency moves forward. That is the subject of today's episode. And so, from Trial Site News, I am Adrian, and our episode is starting right now. So before we deep dive into this story, a couple of quick notes. First, in this video we will not be exploring whether or not the drug is effective against COVID-19. That's not the purpose of this video. Rather, we'll be looking at the lawsuit against the FDA over whether or not they broke the law by issuing their statements on the matter back in 2021. And secondly, as I'm sure you can tell, my voice is a bit crackly, and if you noticed there weren't any episodes last week from me here at Trial Site News on YouTube, and that is because all last week I was down and out with the flu. I missed you all terribly, but there was no helping it. My voice was gone, and I had to give it a complete bed rest. And even though I feel about 90% right now, my voice is still crackly, but hopefully in the coming days, it'll all rectify itself. So, in any case, it's good to be back. I missed you all. And let's continue. So the story that we're going to talk about today is regarding the FDA, who famously or infamously, depending on your point of view, posted a tweet in 2021 telling people that they weren't horses nor cows and should seriously stop it when it comes to taking ivermectin to treat or prevent COVID-19. And they are now claiming in a recent hearing that they, the FDA, were only giving advice and that it was not mandatory when they told people to stop taking ivermectin for COVID-19. As one of the lawyers for the FDA said in the hearing, the cited statements were not directives. They were not mandatory. They were recommendations. They said what parties should do. They said, for example, why you should not take ivermectin to treat COVID-19. They did not say you may not do it. You must not do it. They did not say it's prohibited or that it is unlawful. They also did not say that doctors may not prescribe ivermectin. They use informal language. That is true. It's conversational, but not mandatory. Now this, of course, was in response to the three doctors, Dr. Paul Merrick of Virginia, Dr. Mary Bowden of Texas, and Dr. Robert Apter of Arizona, who brought the case against the FDA for what they claim was illegally interfering with their ability to prescribe medicine to their patients when it issued statements against the use of ivermectin for the treatment of COVID-19. Now, while ivermectin is an approved drug by the FDA, it wasn't approved for use in COVID-19. However, drugs are commonly used for non-approved purposes here in the United States. This is common practice and it is known as off-label treatment. In fact, it is so common that it is estimated that between 40 and 60% of all prescriptions written in the United States are for off-label uses. This is especially true for treating cancer, AIDS, pediatric conditions, and other rare diseases. Now this matters because, as the doctors allege in their lawsuit, the actions that the FDA took interfered with the doctor's practice of medicine, violating the laws including the Federal Food, Drug, and Cosmetic Act. This according to the lawsuit. And they have asked the court to rule that the actions taken by the FDA are unlawful and bar the FDA from directing or opining as to whether ivermectin should be used to treat COVID-19 going forward. The actions focused on in the lawsuit by the FDA are focused and centered around the tweet that we mentioned at the beginning of this program, the one telling people that they weren't horses or cows and should seriously stop it when it comes to taking ivermectin to treat or prevent COVID-19. This was part of a campaign by the FDA to warn people against the drugs used to treat COVID-19. Now, the tweet also linked to a webpage that the FDA created back in 2021 titled Why You Should Not Use Ivermectin to Treat or Prevent COVID-19. The FDA also posted a second tweet on the topic saying, hold your horses, y'all. Ivermectin may be trending, but it still isn't authorized or approved to treat COVID-19. And finally, on a separate page on the website, the FDA stated in regards to a question, should I take ivermectin to prevent or treat COVID-19? And the FDA's answer was a simple no. Now, Jared Kelson, an attorney representing the plaintiffs, told the court during the hearing that the informal claim doesn't explain the language that they actually used. Stop it, stop it with the ivermectin. And he went on to argue that the FDA's actions, quote, clearly convey that this is not an acceptable way to treat these patients. The FDA's lawyers defended their actions by saying that their statements did not bind the public or the FDA, and it did not interpret any substantive rules and did not set agency policy, and that the FDA's position could change in the future if new data becomes available. The lawyers for the FDA also stated that they couldn't be blamed for injuries to the defendants. Now, an example of what kind of injuries they're referring to, Dr. Paul Merrick, one of the defendants, was forced to resign from his positions because he couldn't prescribe ivermectin because of the FDA statements, this according, again, to the lawsuit. However, the plaintiff's lawyer disagreed, saying that, quote, if the government is going to label ivermectin a horse medicine or a horse dewormer and promulgate the idea that it is only for animals, then the natural correlation is that doctors who prescribe it are horse doctors or quack doctors, which has played out. That is enough harm to get into court or have the motion to dismiss rejected. The government engaged in a singularly effective campaign here to malign a common drug that has been used for a very long time and has been dispensed in billions of doses. It is one of the most famously safe drugs in the history of human medicine, and when people did exactly what the FDA said to, stop it with the ivermectin, I don't understand how that would not be traceable back to the FDA. Now, as of now, the motion to dismiss the case that the FDA was arguing for is still pending, as U.S. District Judge Jeffrey Brown hasn't yet issued any ruling on the matter. Naturally, of course, though, we will be keeping an eye on this story as it continues to update, and we'll let you know once new information comes along. Now, in the meantime, major institutions around the world continue to either remain neutral on the matter or caution against the use of the drug ivermectin to treat COVID. An example of this would be the WHO. The World Health Organization, as of their latest update on the matter, still advises that ivermectin only be used to treat COVID-19 within clinical trials. They say that, quote, the current evidence of the use of ivermectin to treat COVID-19 patients is inconclusive. Until more data is available, the WHO recommends that the drug only be used within clinical trials. This recommendation, which applies to patients with COVID-19 of any disease severity, is now part of the WHO's guidelines on COVID-19 treatments. So there you have it. 2 years in, and the WHO still says that they need more data. And that, my friends, will bring our episode to a close once more. As always, thank you so much for joining me on the program today. From Trial Site News, I am Adrian, and I will see you all next time.